Well, now, one area where the NHS is spending more money is diabetes treatment, which already costs £1 million an hour. A special investigation by this programme and by the British Medical Journal has revealed how the health service could have saved as much as £250 million over the last 5 years. That's because a growing number of patients are using a new type of synthetic insulin, which costs at least twice as much as older versions. But experts have told us that the clinical benefits simply do not justify the extra spending. Our science correspondent Tom Clarke has this exclusive report.
Diabetes costs the NHS an estimated £9 billion a year. That's £1 million an hour. A growing proportion of this bill is the cost of one of the main medical treatments for diabetes, insulin. We currently spend £300 million on insulin each year, and the cost is rising all the time. But an investigation by Channel 4 News and the British Medical Journal has discovered that the NHS is spending tens of millions of pounds more each year on insulin than it needs to.
You want tea?
Yes, please. I'll just test my blood.
All right, I'll make it.
Christine Crump is one of 2.8 million people in Britain with diabetes. Like many, she relies on so-called human insulin to keep her blood sugar levels under control. But 5 months ago, she was told her insulin was being withdrawn.
Suddenly being told that it's not available after Christmas puts me in a very apprehensive position because I just don't know what's going to happen.
90,000 people use Christine's form of human insulin. All of them will be forced to abandon it by the end of this year. The manufacturer is offering a new variety of insulin, but Christine says she is allergic to all other forms besides the one she takes.
I've tried different ones before and I cannot take any of them. Within an hour or two, I'm itching all over my body. I don't see why they should stop making it when there are so many people asking for it to be continued.
The manufacturer, Novo Nordisk, says it has sought the advice of the Department of Health and others to minimise concern and ensure patients are given a suitable alternative before withdrawal so the transition is effective. The company says it's stopping the product because when newer ones, which are safer or more effective, become more widely used, manufacturing the older versions is no longer cost-effective. What Christine didn't realise was that she'd become swept up in a massive shift in the $12 billion global insulin market. Pharmaceutical companies have developed new forms of insulin known as analogues, which are fast replacing previous products. Analogues have a number of proven benefits. They can be more convenient to administer, are more successful in controlling mild hypoglycemia, that's worrying drops in blood sugar, and can cause less weight gain. As a result, analogue insulins have proved very popular with patients. The vast majority of insulins prescribed in the UK are now analogue, but these newer forms come with a disadvantage. Many of them cost 2 to 3 times more than the older human insulins. And it's NHS hospitals that bear the increased financial burden.
Come on in.
Dr. Amanda Adler advises the National Institute for Health and Clinical Excellence, or NICE, on the cost-effectiveness of diabetes treatments in the NHS. She carried out an official review which included looking at whether these analogue insulins are worth the extra money.
Do you want to see how you get by with a bit less insulin?
She looked at long-acting analogue insulins, the main form of medicine given to people beginning insulin therapy. They're produced for the NHS by drug companies Sanofi-Aventis and Novo Nordisk. She came to a startling conclusion. Despite millions being spent on these newer, more expensive insulins, the clinical advantages to most patients are modest.
Okay, she's going to give you a ring then. Yeah. There is no difference in their ability to lower blood glucose. While they are associated with less weight gain, that weight gain is modest, on the order of ounces to pounds per patient. And there is no difference in severe hypoglycemia.
Dr. Adler's research suggested these modest advantages were only relevant to a minority of patients, those with mild hypoglycemia, for example. So she concluded most NHS patients with the common type 2 form of diabetes should start on the cheaper human insulin first.
I would estimate that about 90% of people with type 2 diabetes would probably do quite well on these human NPH insulin as compared to the long-acting insulin analog.
90%, the vast majority.
Yes.
She and other experts we have spoken to estimate that a substantial majority of these diabetics could successfully remain on human insulin. For them, using analogues would not be good value for money for the NHS.
If I spend twice the price for something, I sort of, more or less, expect to get twice the benefit. It is unfortunate because we would like that money to do other things with it. It might be treat breast cancer. It might be prevent diabetes. We have lots of things we could do with it. Do you think you were having a bit of hypo out there in the waiting room?
Yeah.
Yeah, I think you might have been. So.
Dr. Adler's research led to NICE issuing the guidance that most people with type 2 diabetes should be started on cheaper human insulins. But the reality is that the majority of type 2 diabetics are being started on more expensive analogues. This is quite hard to believe, but it seems that for the majority of people with diabetes, these newer analogue insulins are no better than the medicines that they were on before. Yet doctors are prescribing them. We as taxpayers are paying at least twice as much for them. And the guidelines to control the prescribing of medicines are being ignored. Studies seen by Channel 4 News back up the NICE findings. Their conclusion is that all types of analogue insulin offer little clinical advantage for most diabetes sufferers. The cost implications for the NHS are potentially massive. Figures collated by Channel 4 News suggest that if just half of those taking analogue insulins had been put on the equivalent human insulin, the NHS would have saved at least £250 million over the last 5 years. We put our findings to the drug companies. First, we asked Sanofi Aventis, who sell most of the long-acting analogue insulin in the UK, about the NICE guidelines. Regulators say there aren't significant clinical benefits for analogue insulins over human insulins given the extra cost. Are they wrong?
The value to patients is that the modern insulins offer a much better experience. Compared to human insulin, they're less likely to have an attack of a dangerously low blood sugar. And at the end of the day, this adds all up to real value.
Because your products are now more expensive, you're putting an additional cost burden on the NHS. How can you justify that?
Using modern insulins, you have to look beyond the cost of just the insulin itself. It's allowed treatment to move out of hospitals, back into primary care, back into GP surgeries. We know that's a cheaper place to treat diabetes. There are some cost benefits back beyond just the cost of the insulin.
We asked for Novo Nordisk's comments in writing. When we put Dr. Adler's comments to them, they responded that there are many other diabetes specialists in the UK who believe that insulin analogues are the most appropriate treatment for their patients. They also stressed the advantages to patients of analogue insulins, citing flexibility, convenience and the reduced risk of major and nighttime hypoglycemia. With regard to NICE's guidelines, they said,
"Looking at the cost of diabetes drugs in isolation does not give the full picture of the financial, social and economic impact of diabetes or the clinical benefits that newer drugs incur."
Lilly UK, which supplies the NHS with different versions of insulin, which were not directly examined by NICE, said,
"We believe in providing a broad range of treatment options, which is why Lilly regularly reviews its product portfolio and makes decisions based on patient demand, the needs of our prescribing customers, as well as market conditions."
They also told us they had made a commitment to patients and the NHS to supply human insulin for at least the next 5 years.
There's actually only one way of lowering blood glucose, and that is by the interaction of insulin with its receptor.
Professor Edwin Gale is one of Britain's foremost diabetes experts.
I happen to think the NICE advice is absolutely on the button, and it's what we should be doing. Analogue insulins are indeed of a benefit to some people. The problem is that the benefits have, in many people's opinion, been rather oversold.
With the stakes so high, the three big manufacturers, Sanofi Aventis, Novo Nordisk and Lilly, who make a different version of analogue insulin, are competing for market share in the lucrative UK insulin market. And it's a battle being fought on the corridors and in the waiting rooms of our hospitals.
The choice of insulin is usually determined by a practice nurse or a specialist diabetes nurse. And these people have been courted assiduously by the companies. And many of them will believe as an article of faith that these insulins are better.
Dr. Adler is based at Addenbrooke's Hospital in Cambridge. She has concerns about the way in which drug company representatives approach NHS staff and promote their diabetes products.
When you walked in here today, you may have passed a drug representative who feels apparently quite entitled to come into patient areas and hospital clinics. If anyone else were to walk into the hospital clinic, they might be tackled by security.
So you said they'll just walk into the clinic?
They will just walk into the clinic, and we have suggested that a drug representative make an appointment first, like anybody else would do.
Is it responsible for reps to invite themselves into diabetes clinics without an appointment?
We'd normally expect all our representatives, all our staff, to have appointments with healthcare professionals and not just to attend in the clinic unannounced.
But isn't it the case you do use the NHS as a marketplace for your product?
We feel it's important to make sure that everyone involved in treating a disease is fully aware of the facts and information so that when they make a prescription choice, they're choosing what they believe is the product will give the best benefit for the patient.
The cost of these new insulins is also causing concerns around the world. Channel 4 News has seen an internal World Health Organization document written by the WHO's head of essential medicines in Geneva. The unpublished paper reveals concerns that a few giant companies are pushing the newer types of insulin around the world at 3 to 5 times the price of human insulin, while their cost effectiveness is not fully established. We put this to the drug companies, but they declined to comment, not having seen a copy of the report. Its author is concerned about the cost burden in poorer countries.
You simply cannot afford to spend half your salary on these medicines. And that basically means that in the end you give up. It leads to personal bankruptcies, it leads to poverty, and in the end it leads to death.
Switching from one insulin to another can be a traumatic experience. Now that so many diabetics in Britain have converted to analogue insulins, a number of our leading authorities have said it makes more sense not to change patients back. Instead, they say the NHS should try to renegotiate contracts, as they have in other countries.
We should not just lay ourselves open to skilled marketing. We should ask for evidence of value, and we should negotiate down the prices.
In a statement, the Department of Health told Channel 4 News that it has specifically drawn doctors' attention to the NICE guidance on prescribing these newer, more expensive insulins. If new analogue insulins were wonder drugs, we might be happy to pay the price. But the evidence suggests they're not. Many experts believe they offer modest clinical advantages for a significant increase in cost. And it's one that's being paid by us all.
That special report from Tom Clarke. Now, with tonight's top business, culture and science news, back to Samira.